All right, so today we're gonna dive into something uh, pretty complex and potentially controversial.
Yeah.
It's the World Health Organization, and specifically, we're going to be talking about the funding for the WHO, and then also the implications of that recent decision by the U.S. to withdraw.
Right.
And to guide our deep dive, we've got a stack of sources here: news reports,
Yeah.
opinion pieces, even a blog post from somebody calling themselves Doc Vince. So
Yeah, it's a really fascinating landscape, and there are very, very strong opinions on all sides of this issue. And I think what's at stake here is not just, budgets and bureaucracy. We're really talking about global health leadership and the future of pandemic preparedness.
yeah, for sure.
So
Okay, so to kick things off, let's unpack a little bit about the structure
yeah.
of WHO funding, because it's a bit more intricate than a lot of people probably realize, right?
Definitely. And, I think you've got your sort of standard assessed contributions from member states, right? So everybody chips in based on, their economic standing. Makes sense, but then you have this whole other layer of these voluntary contributions, and that's where things get a little bit
Interesting,
so I don't know.
interesting, and a little murky, because this is where we see these major players, like the Bill and Melinda Gates Foundation,
Right.
stepping in, and their donations are so substantial that it sparked this whole debate about, what kind of influence they might have over the priorities of the WHO.
Exactly. And it's not just the Gates Foundation either. Gavi, the Vaccine Alliance, they also receive funding from both governments and private organizations. And so, it really kind of begs the question, does this heavy reliance on these voluntary contributions, particularly when they're earmarked for, very specific projects, does
Yeah.
that create a system where certain global health issues get prioritized over others?
And who gets to decide which issues get that spotlight?
Mm,
Right. If it's
yeah.
if it's the people with the deepest pockets, that raises some pretty serious questions about how how that agenda gets set for the WHO.
Yeah.
It's kind of like if you go into a restaurant and there are a couple of patrons who are very, very wealthy, and they get to dictate the whole menu for everybody else.
Right.
You know what I mean? And everyone else just has to kind of take what they get.
And I think, that analogy really highlights one of the key concerns here, which is this potential for these power imbalances, within the WHO's funding structure.
Yeah.
And, critics would argue that this really makes the organization vulnerable to donor influence, and it can really shift the focus away from other, equally pressing health issues that maybe don't have such a powerful champion.
So how does this kind of play out in practice? Are there any specific examples where we can really see how this potential influences has maybe shaped the way the WHO has handled recent global health crises?
Yeah, I think, one example that's been particularly hotly debated is the emergency use authorization or EUA mechanism
Right.
that was used during the COVID-19 pandemic
Mhm.
to really fast track the availability of vaccines.
Then EUA, yeah, and obviously that allowed, for a much faster rollout of the vaccines, which
Mhm.
in the face of, rapidly spreading virus was absolutely critical.
Mm.
But then on the other hand, you have these concerns about, are we bypassing the full regulatory approval processes?
Precisely. And so I think the EUA really presents, this complex dilemma, right?
Yeah.
How do you balance the urgency of a pandemic response with the need for, thorough safety evaluations? And some argued that this pressure to move quickly, combined with the influence of these powerful donors who, may have a vested interest in vaccine development, that this may have led to compromises in safety protocols.
Which then, of course, feeds into, public distrust.
Right.
If people believe that, financial interests are somehow dictating these really critical health decisions, it can have a really chilling effect on their willingness to, follow guidance from organizations like the WHO.
It's a really valid concern, and public trust is absolutely essential, in global health, particularly during pandemics, and any perception of undue influence can really, chip away at that trust.
And that brings us, I think, to kind of the elephant in the room here,
Yeah.
which is the U.S. withdrawal from the WHO. And this wasn't just like a sudden decision. This has been kind of a saga that's been unfolding, hasn't it?
It's definitely a story with, multiple chapters, I think. And, we saw this long buildup of criticism really coming from the Trump administration,
Yeah.
particularly focused on the WHO's relationship with China during those, early stages of the COVID-19 pandemic.
Right. Trump repeatedly accused the WHO of being China-centric, right? Saying that they mishandled the pandemic and that the U.S. was, being asked to shoulder this unfair financial burden.
Mhm.
He even issued that executive executive order, citing these concerns, and that kind of paved the way for the U.S. withdrawal back in 2020.
Which, of course, Biden then reversed upon it taking office, which really signaled, I think, a return to multilateralism in global health. But then you have, this unexpected twist where Trump actually reinstates that withdrawal order as one of his first actions, upon returning to the presidency.
So dramatic.
Yeah.
It's like a real, turn of events, and who knows what the consequences are going to be.
Right.
But to kind of try to get a handle on this, I think it's helpful to really explore the arguments for and against the withdrawal.
Yeah.
Because they really illuminate, I think, what's at the heart of this whole debate.
I think understanding those arguments requires us to really dig into the different perspectives that people have about, global health governance and the role that the U.S. should play in shaping that landscape.
Absolutely. Okay, so let's start with some of the concerns that have been raised by people who are opposed to the U.S. withdrawal. They argue that this move is going to weaken the U.S.'s global health leadership and could really seriously hamper these efforts to prepare for future pandemics.
Yeah, and that's a common thread that runs through a lot of these sources we're looking at. Public health experts warn that stepping away from the WHO could limit access to really crucial data and, hinder progress on combating diseases like malaria, tuberculosis, HIV, AIDS.
Right.
These issues that really impact millions of people globally.
Yeah, and it's not just about the practicalities, right? There's also this symbolic element, I think, at play.
Yeah.
The U.S. has historically been this major force in shaping global health policy, and stepping back now could signal a real shift away from that commitment. And it's not inconceivable to think that other actors might rush in to fill that void.
Exactly. And some analysts have even suggested that, a U.S. absence could actually increase Chinese influence within the WHO, which is, kind of a consequence that runs counter to the intentions of, the people who are actually advocating for the withdrawal.
That's a fascinating point. It's almost like a geopolitical seesaw. One side goes up, the other side goes down. But okay, so let's dive into the arguments that are in favor of the withdrawal now.
Okay.
And this blog post by Doc Vence is interesting because it presents a perspective that we also hear echoed in some of these other sources.
Yeah, Doc Vence raises some really pointed questions about, the WHO's accountability.
Yeah.
And he argues, quite forcefully that an unelected body, shouldn't have so much power in dictating global health policy for the world.
It's an argument that really resonates with, a certain segment of the population, particularly people who are maybe a little bit skeptical of international organizations and concerned about, national sovereignty,
right?
Those sorts of things. And then you also have, these concerns about potential bias within the WHO stemming from, their reliance on private funding, especially from the pharmaceutical industry.
Right. And Doc Vence really doesn't mince words here. He basically asks, who's really calling the shots? And I think this really ties into this, broader distrust of large institutions and this feeling that they may be more beholden to special interests than to the public good.
And it really aligns with a lot of the criticism that came from the Trump administration as well. Right? They view the WHO as too slow to respond to the COVID-19 pandemic, too willing to accept information from China without, proper scrutiny.
Right.
And then there's this other thread that I think is running through these arguments as well, which is the idea that the U.S. can actually be more effective by, forging its own path, partnering with like-minded nations on specific health initiatives rather than, working through this global organization that they see as flawed.
And that approach really emphasizes, flexibility and autonomy.
Yeah.
Proponents argue that it allows the U.S. to really direct its resources and expertise where it sees the greatest need without being, bound by the constraints of a large bureaucratic organization.
So we've got these two really contrasting visions here, right? We've got one vision that emphasizes multilateral cooperation and global solidarity, and then this other vision that prioritizes national sovereignty and strategic partnerships.
Right, and the U.S. withdrawal from the WHO really becomes this flashpoint where these two competing visions clash.
Exactly.
But I think it's really crucial to kind of look beyond the political rhetoric here and examine the potential impact of this decision.
For sure. So let's talk about the implications. And I think the most immediate one is obviously the financial hit to the WHO. The U.S. contributes almost 20% of their budget.
Huge.
So pulling out leaves this, pretty significant hole.
Yeah, it's a substantial blow, and it really raises questions about, the organization's ability to maintain its current level of programming.
Yeah.
Some programs may face cuts, others might see funding, from other nations, which could then lead to shifts in priorities and influence within the WHO. So it's not
Yeah.
just about the money itself, it's about these ripple effects.
Yeah. Who steps in to fill that gap, and what conditions might they attach to their support? And then there's the longer term consequences to think about.
Right.
Could this move weaken global cooperation on health issues,
Yeah.
More broadly?
Yeah, and that's a key concern that's been voiced by a lot of experts. They worry that the U.S. withdrawal could set this precedent
Yeah.
that encourages other nations to kind of prioritize their own interests over collective action.
Which could then make it harder to, mount this coordinated response to future pandemics.
Right.
I mean, nobody wants to see a repeat of those early days of COVID-19, where countries were just scrambling for resources and information.
Exactly. And it's not just about pandemics. Global health challenges really require collaboration on a whole range of issues, from tackling antimicrobial resistance to addressing, the health impacts of climate change.
For sure.
And a more fragmented approach could really hinder progress on these vital fronts.
So we're left with a lot of uncertainty here.
Yeah.
It's like standing at this fork in the road.
Uh-huh.
One path leads towards, greater global cooperation. The other path leads towards this, more fragmented, every nation for itself approach.
And the direction that the world takes really hinges on the decisions that are made by governments, organizations, individuals in the coming years.
Okay, so we've kind of laid out the arguments, we've explored the potential consequences, but I'm still left wondering, if the U.S. does fully withdraw from the WHO, what comes next? What happens then?
Yeah, it is the big question, isn't it? And, it's not like our sources offer a crystal ball or anything, but they do point towards some possibilities that I think are worth exploring. Yeah, some experts believe that a U.S. withdrawal could actually lead to a kind of shift in the global health landscape,
Okay.
with regional organizations like the Africa CDC potentially taking on a more prominent role.
So instead of having, one global health powerhouse, we might see a network of these regional players kind of stepping up to fill the void.
It's a potential outcome, and like with so many things, there are both, potential positives and negatives.
Yeah.
On the one hand, it could lead to more tailored responses, right?
Oh, yeah.
With these regional organizations being, better equipped to really address the specific health challenges that are facing, their populations. But then on the other hand, it could create fragmentation,
Right.
making it much harder to coordinate global efforts on issues that really require a unified response.
Yeah, it's that trade-off, isn't it,
Right.
between, localized expertise and global coordination.
Exactly.
And then, of course, there's the question of, private philanthropy organizations like the Gates Foundation.
Right.
They already play a significant role in global health.
Huge.
And, they start to, step in to fund programs that were previously supported by the U.S. government. Their influence could grow even more.
Right. And that raises these really important questions about, accountability and transparency.
For sure.
Who's deciding which programs get funded? Are those decisions being driven by, a broader public health agenda, or are they more about the specific interests of the donors?
Right. And then it's not just about the money. The WHO has this vast network of scientists and researchers and public health professionals.
Yeah.
If the U.S. withdraws, are they going to be able to, attract and retain that same level of talent and expertise?
That's a critical consideration. Building and maintaining a global health workforce, it takes more than just financial resources. You really need to foster this environment of collaboration and innovation and scientific rigor.
So maybe this is where, individuals like you and me actually come in.
Yeah.
Even though this might feel like a very, high-level political issue.
Yeah.
It ultimately impacts all of us.
Absolutely. And we can stay informed. We can engage in these conversations. We can, hold our leaders accountable. We can support organizations that are doing impactful work on the ground.
Right.
And maybe most importantly, we can resist the urge to kind of succumb to cynicism or despair.
Because even amidst all of this, all this uncertainty, there's still room for for agency and hope.
Absolutely.
The future of global health governance, it's not predetermined. It's being shaped right now by the choices that we make.
And that's really the key takeaway here. We're not just these passive observers in this unfolding story. We have the power to influence its direction.
Yeah.
And that's both a responsibility and an opportunity.
I love that. So as we wrap up this deep dive, I'm left with, I think, a sense of cautious optimism.
Yeah.
It's a complex issue. There are no easy answers, but it's a conversation that we absolutely need to keep having.
Yeah.
And ultimately, it's up to each of us to decide, what role we want to play in shaping a healthier future for everyone.
That's the spirit of the deep dive. Exploring these complex issues, uncovering these diverse perspectives, and ultimately empowering our listeners to really, engage with the world around them.
We'll be back soon with another deep dive into a fascinating topic. Until then, stay curious, keep questioning, and keep learning.